I'm Dr. Darian, and I'm back with part 2 of the patient who presented with severe left lower quadrant pain and fever. Just a reminder, this patient had been complaining of abdominal pain for about 2 months, and about a month prior to his presentation to the emergency room, he was diagnosed with a urinary tract infection for which he was prescribed antibiotics, but unfortunately he seemed to just not get better on the antibiotics. And now he's presenting to the emergency room with severe abdominal pain and fever. The radiologist actually called me to say that there are a couple of things wrong with this patient's abdominal imaging. The first problem that was identified was a problem called diverticulitis. Diverticulitis is actually a common problem that I actually see and diagnose probably about once a week, so I just want to break down exactly what it is. So quick medical minute, our large intestine is the last part of our GI system that our waste goes through before we poop. A common problem that's usually diagnosed on routine colonoscopies is a benign problem called diverticulosis. This is just natural outpouchings of the colon, and it's thought to be associated to a low-fiber diet. Some physiologists believe that a low-fiber diet slows the transit of our bowels, causing a low level of constipation. And therefore, when you apply pressure, when you're pushing, that pressure has to go somewhere. And if it doesn't cause a normal bowel movement, it can cause these outpouchings. This is a normal view of the inside of the large intestine during a colonoscopy. Just so that you're aware, air is actually insufflated or put into the colon to help blow it up so that we can see the inside. And if you look at this image, this is of someone with diverticulosis. The arrows are highlighting each of the diverticula, just so that you know diverticula is a Latin origin for a blind ending. These are just random outpouchings that are, again, benign. Sometimes these small, benign outpouchings can become infected, and that causes a problem called diverticulitis, just so that you're aware, itis means inflammation or infection. Diverticulitis is treated with antibiotics, but in some patients it may persist and cause problems, like an abscess formation or scarring or stricture of the colon. Today, the Pope had surgery for treatment of this complication, which tells me that he likely has been dealing with this issue for a long time. Back to our patient. The second issue is that he also, aside from diverticulitis, had an abscess that had formed in his colon. An abscess can form with any infection when the body tries to wall off the infection. That creates an opportunity for bacteria to grow inside the abscess and enlarge and cause more problems. Sometimes an abscess or an infection can cause inflammation or irritation of nearby organs, and that includes the bladder. Remember, this patient has an infection called diverticulitis that's in their colon, and so that is in close proximity to the bladder, and a constant persistent infection can cause inflammation and an abnormal connection between two organs that are closely together, and that is called a fistula. This patient's persistent diverticulitis led to a fistula formation between the colon and the bladder, which is why the patient had chronic UTIs, because waste matter was traveling from the colon through the bladder and causing urinary tract infections. Alright, you just learned a lot of anatomy, including the diagnosis of diverticulosis versus diverticulitis, and also the complications of that diagnosis. Hopefully this was helpful. Let me know your questions and comments below.